Well, a port city in British Columbia is on track to become one of the first communities in Canada to vaccinate all eligible residents against COVID-19. The province's first large-scale mass vaccination clinic has now opened in Prince Rupert, with the goal of immunizing all 12,000 residents by mid-April.
It was wonderful. I'm so happy that I've got it finally. It means I can see my friends soon. It's going to change life totally. No more hiding in my house.
As of this morning, almost 5,000 appointments had been booked for the clinic. City and health officials decided to open up vaccinations to the general population after reporting elevated rates of COVID-19 infection along BC's north coast. But not everyone is welcoming this news. Some have criticized the decision as rewarding bad behavior and allowing queue jumping. For more now, I'm joined by Blair Mirau. He's a city councillor in Prince Rupert and is in support of this program. Hi, councillor. Thanks for taking the time to be with us on Canada Tonight.
Thanks so much for having me.
So first, give us some context. How has this pandemic impacted your community to the point that it was prioritized for this program?
Well, what's important to note is that Prince Rupert actually got through the vast majority of 2020 with almost no confirmed cases of community transmission. And when we look back in hindsight, the start of Prince Rupert's issues can really look back to the early January with the outbreak of COVID in our long-term care facility known as Acropolis Manor, where now we're experiencing some of the highest per capita COVID rates in the province. We've lost 14 of our friends, neighbors, and loved ones. We have numerous active exposure advisories in our schools and our homeless shelter. So while we've had a long time where COVID was something that we were watching on the news from Prince Rupert, it really hit home mid-January.
So when was the decision to prioritize this community, and what will the impact of that be?
My understanding was the decision was really made last Sunday, and so the mobilization has been incredible over the last few days. There's been about 400 community volunteers that have put their names forward to help at this clinic. We have teams from Northern Health, the province, the CDC, city staff. There's so many people that have made this thing a reality very, very quickly. So we're expecting to ramp up and have over 1,000 people vaccinated every day.
I guess one of the questions is, what's the impact if you don't do this? Why did they feel that this was such an important step to take in this hot spot?
I think you need to weigh the risks, and you're trying to minimize loss of life and critical care cases, as well as not overwhelming our healthcare system. So in Prince Rupert, we're a rural and remote community on an island in the north by the Alaskan Panhandle. We have a handful of acute care beds that before the pandemic were already operating over capacity. We have some of the highest rates of poverty and vulnerability in the province, which we know is a contributing risk factor. We also have the second highest proportion of Indigenous residents of any city in Canada aside from Winnipeg, and we know that they've been disproportionately impacted by this pandemic. And as well, in December, Northern Health actually had to announce that if you tested positive for COVID and you weren't designated as a high-risk group, you now had to do your own contact tracing and notifications.
And so you mentioned the Indigenous population, because in some areas, Indigenous people have been given priority in vaccination programs. So why not go that route in Prince Rupert and prioritize that community first and then move along through the age groups?
Well, that has already happened, where our regional hospital serves the First Nations communities of Lackalams, Metlakatla, Kitkatla, and Hartley Bay in some cases. So those vaccinations in those outlying communities have been completed, as far as I understand, as early as January. And they were prioritized, obviously, because they don't have doctors or enough doctors or acute care beds in their respective communities. So our regional hospital is really meant for the entire region. And so if I'm the province and I'm weighing the risks and trying to mitigate or avoid a situation where the healthcare beds are overrun, then this is the right decision, in my opinion.
So what happens once your community does get fully vaccinated, or the majority does? Does that mean they get special privileges? And are you worried that people will become complacent and not take precautions?
I'm still urging everyone to not be complacent. We can't rest on our laurels. We have to continue being as diligent as we have been. And it's important for your viewers to note that, unlike other cities that have seen anti-mask and anti-lockdown protests, Prince Rupert was actually one of the first cities in BC, if not one of the only, to declare a local state of emergency and ask our residents to extend the 14-day self-isolation period, not just for international travel, but domestic travel as well. So throughout this entire pandemic, our community has been asking leadership to be even more stringent than the current guidelines in place. So I don't see our community letting up. I don't see us somehow not taking this seriously once everyone's vaccinated. But we do have the unique position to be able to look at what a post-pandemic spring could look like, as opposed to the rest of the country, which is still looking, at maybe what a post-pandemic summer could look like.
And what's the response been like? What's the uptake been from people who, well, I guess everyone is eligible, every adult?
The uptake has been incredible, and we're expecting, it's been said that we were hoping to be done by April 1st. I'm incredibly confident, based on what I've seen this first day and a half, that we'll be ahead of schedule. There's been tremendous uptake from the community. We're incredibly thankful and grateful to the province for being prioritized. But I would add that it's obviously bittersweet for us in Prince Rupert that while we're incredibly happy to be prioritized, it's really quite tragic that what it took is some of the highest per capita case counts in the province, that it took the deaths of 14 of our loved ones and dozens of our frontline healthcare workers testing positive. So it's an incredibly positive, uplifting, optimistic mood on the street, but it is obviously tempered with that bittersweet reality.
All right, Blair Mirau is a city councillor in Prince Rupert, one of the first communities in Canada to vaccinate all eligible residents against COVID-19. Thanks, councillor, for taking the time to speak with us.
Thanks again so much for having me. It's really appreciated.